It's 7:35 right now. It is a tragic reminder of the dangers of measles. A young child in Texas has died from the virus, the nation's first measles-related death in decades. Health officials are urging caution as cases continue to rise across the country.
Joining us now is Dr. Eric Asher, a family medicine physician at Northwell Health Lenox Hill, to help us understand the risks and how we can really protect ourselves and, more importantly, our children as well. Dr. Asher, good to see you again.
Likewise, thank you.
And this is just such a tragic situation too, right? So I guess, can you explain first and foremost just how dangerous measles can be, particularly for young children?
Measles is extremely dangerous. We know it is highly contagious, and if you're exposed to measles and you're unvaccinated, there's a 90% chance that you're going to come down with the virus. Now, measles could start as simply as a high-grade fever, but it could change into something like pneumonia, brain swelling, blindness, deafness, death. It's not good. It is really extremely preventable, and that's why this is hitting hard to the medical community.
Yeah, what are some of the symptoms then that will pop up to let us know that this possibly could be measles?
So it's going to start with that high-grade fever, and the typical symptoms of measles is that rash. It starts at the hairline, spreads through the rest of the body. We're going to see white spots around the lips, cheeks, and inside the mouth, and that's when you know that you have to call your doctor.
And you said it's preventable, right? So obviously so many folks get the vaccine, but we've seen a rise in measles cases. So how much of this is due to a decline in vaccinations? And is that what you say when the medical community is so disappointed in it?
Absolutely. This is 100% related to lack of vaccination. When we look at the communities where we see the spread of measles, it's in those communities that are vaccine hesitant. And we know that even one child infected with measles could go on to infect 10 to 20 others very easily. This spreads within a couple of hours with just the respiratory droplets in the air and on surfaces. Hand sanitizer doesn't work against this. And we know that the vaccine is 97% effective. For something that's that high of level of protection is not very common. So it is extremely important that if your child is a vaccination appropriate age or hasn't been vaccinated, please speak to your pediatrician. Even one death is one death too many when it comes to a disease that's extremely preventable.
Wow, I mean, you could be sitting in a room with someone that has the measles. It's that easily transmitted, right?
Very, very contagious.
Yeah, okay. Well, then let's just say a parent, a caregiver with a child that has measles, how easily can they get it, and should they be concerned?
Absolutely. If there's somebody who's not vaccinated, they should absolutely be concerned. It's a 2-dose series. The majority of folks have gotten it. It's been around for 60 years. And if somebody is unsure of the vaccine state, if they've gotten it before or not, if they're wondering if their immunity has waned from it, you could speak to your doctor. You could get a very simple blood test that'll tell you if you're protected against the virus.
You know, I was at the playground yesterday with my daughter, and I wasn't eavesdropping. Well, I kind of was, but I was listening to somebody's conversation, and they were saying, well, my child's vaccinated, right? So do I have to be concerned amongst people in a playground setting where it might live on a surface or so on and so forth, right? So for those who do have a vaccinated child or they themselves are vaccinated, what's the concern level that they should have?
If you're vaccinated and your children are vaccinated, the other caregivers at home are vaccinated, there is very low likelihood of contracting the virus.
Yeah, I think a lot of parents are like, well, I'm an adult. Is there still a vaccine for someone my size? Because you think measles vaccine, you think of a child.
Absolutely. As a healthcare professional, I have to have my titers checked every now and then. And just this past summer, one of my titers waned a little bit, so I needed to get revaccinated. It's very easy. There's
How did you know that?
symptoms.
How did you know?
I had to get a blood test.
Okay.
I had to speak to my doctor. I got a blood test, but there were no symptoms to the vaccine. The most common things that we hear from parents is maybe a little pain at the injection site, maybe a little bit of low-grade fever, rash, but that only lasts a couple of hours to no more than 24.
Yeah, I mean, that's great. A lot of schools and daycares and so on and forth, they require the measles vaccine before allowing somebody in. So the risk there is relatively low, right? But for that blood test you were just talking about, piqued my interest here. Is that something you ask your doctor for? Go in and say, hey, like I want to see where my immunity levels are for things like the measles as an adult?
Absolutely. If you're unsure if you've been vaccinated for measles, if you're unsure if you were vaccinated for something like the chicken pox, it's a very simple blood test. Your doctor will absolutely be able to do it for you in the office if they have labs. And you would have a sense of protection
But
knowing you're protected or
you have
not.
to specifically ask for it, right? Because it's not included in like your blood panel that you would get for
Yeah.
a physical.
It's not considered routine.
Okay. What would be the bottom line then that you would say to families?
This is an extremely preventable disease. If you have not been vaccinated or your child has not been vaccinated, there's no reason for that. If you're seeking care from a provider who is dissuading you from having a vaccine, please seek care somewhere else. This is something that even one death, like I said before, is one death too many. We know this is extremely contagious, and anything that we could do to limit the spread and limit illness, limit death, especially in a vulnerable population, is so important.
Dr. Asher, thank you so much for your time. We always appreciate seeing you.
Thank you. Stay well.
You too.
too.